how do they begin their preparation, and how do they then proceed with it?
I think it's MCQ specification guidebook, something like that. It's on AMC's website only.
Yep.
It tells about the blueprint of everything, and in the last pages there is a list of resources. Hmm.
So, how was your experience with the crash course? Like, you obviously were watching the recorded videos. Okay.
It was nice, and I tried to watch at least two videos every day.
Hi, Dr. Satvik. Congratulations on clearing your AMC 1 exam.
Thank you, ma'am.
Okay. So, Dr. Satvik, please tell us something about yourself. Where did you do your medical graduation from, and how did you actually make this decision of starting with academically with your preparation?
Ma'am, I did my undergraduation from Mauritius, actually, SSR
Okay.
Medical College, Mauritius. Then I gave FMG exam, and then I got an internship here in my city
Okay.
only. Yeah, and then when I started doing my internship, that's when I thought, okay, I I started thinking about moving abroad somewhere. And
Okay.
yeah, like I weighed all my options, and I thought that this was the best one. AMC was the best one. Mm.
So I think a lot of students they want to ask this question, especially to their mentors or people who have cleared AMC one. How do they begin their preparation, and how do they then proceed with it? Because, like
Mm.
there are a lot of resources. Uh, Sometimes people find it confusing as to when to refer to which resource. So if you could just
Mm.
give like a simplified yet explanatory view on how should one prepare.
Ma'am, I think first of all, there's a MC, I don't remember the exact name, but I think it's MCQ specification guidebook, something like that. It's on AMC's website only.
Yep.
It tells about the blueprint of everything, and in the last pages there is a list of resources. So if someone is confused about resources, then those are like the best ones that
Best
they can
ones. Okay.
use. And then personally for me, I felt quite lost. I started preparing, and after 1 month, I was also doing internship. So after 1 month, I couldn't handle. Many people can handle. I couldn't handle to check for every question, going on another website, and
Mm-hmm.
and then also I wouldn't be sure that okay, is this the right answer or not, because there are no proper questions or answers for this, right?
Mm-hmm.
So that's when I chose that okay, I need some guidance, and hence I took a academically crash course. Yeah.
Okay.
Mm.
So, how was your experience with the crash course? Like, you obviously were watching the recorded videos.
Yeah, I was watching recording videos.
Okay.
It was nice, and I tried to watch at least two videos every day.
Mm-hmm.
And I did not do the mocks along with them, but I did try to read the PPT also, which is available within a few hours.
Yeah.
And yeah, I tried to revise that before sleeping. And like initially, I did that, but later stages, I tried to pick my pace, and I started doing the mocks and everything. Mm.
Okay. How about
Mm.
like the blue book and the red book? Did you go through them?
Yeah, the red book I went through like the whole book. I sat one day on a weekend and I read through it all, and I wrote whatever I felt was important in a different
Okay.
copy so
Make
that I
notes of
wouldn't
the
have to
important.
open this again. Yeah,
Yeah.
like colon cancer and these things
Yeah.
are very commonly asked, right? So these I wrote, and then handbook I did I did twice. Like the first time I did it, I would do 10, 15 questions when I'm sitting, just like
Mm-hmm.
that,
Mm-hmm.
or sometimes 20, like little bit, and I would read the explanations. Because what I felt with this exam, it's very important to get into the Australian mindset, leave the Indian mindset. The FMG exam is there's a question, there's answer, you know it, and
Yeah.
90% of questions will be like that only. That this is the question, this is the answer. You don't have to think that much about it. But in
Mm-hmm.
AMC mindset, you have to look at every line, the age, then you have to, where is the patient presenting? Is it in the hospital? Is it
Yeah.
outside? And what is the time frame? Like many things. So I think that is a bit more difficult to get into.
Yeah, so I think
Yeah.
like they have
Mm.
actually made an interplay of a lot of clinical scenarios together, and then they want
Yeah.
you to come to that final answer, and where
Hmm.
maybe like more than one answer is right, right?
Yeah, yeah. It always feels like more than one answer.
True.
Mm.
So, what about like, how did you manage this time management things? A lot of students get confused. Like sometimes, they are
Hmm.
like, we couldn't complete our exam, two questions were left, or we just completed it
Hmm.
at the edge. So, how do you think one can overcome this?
Ma'am, I think first of all, the mocks, like you have to develop a habit of reading the question quickly
Mm-hmm.
and going through the options also quickly. And like, I mean, you just have to practice that as you keep
Okay.
going. And like to pick some keywords in some questions. Like when you start practicing it, your brain automatically finds things in between. I mean, AMC is an exam with all new questions, but still they repeat topics. So sometimes when you're by the third line, you can have a hint, okay, this is going in that direction.
Yeah.
So I think that bit helps. And of course, the you have to see some recall questions also. That is a big help.
Yeah.
Yeah, that
Got
helps
it.
a lot. Mhm.
So, tell us about
Mhm.
how did you study with the last year questions or recalls? Do you think they are important, or like people like pay too much emphasis on it and they are not that important?
I think they are pretty important. I mean, they're not very, very important that you will fail if you don't look at them. They're not that
Mm-hmm.
important, but they are important in the sense that you at least get to know the topics which you might need to revise at the last in the last days, because it's a lot for to revise in the last few days. And
Mm-hmm.
uh, I think ma'am also Swapnil ma'am or someone also conducted a like from academically. They also conducted a few sessions,
Okay.
and they were also quite helpful. In fact, I did get one of the questions from that recall also. I remember.
Okay.
Yeah, and at least if you know the topics, then it helps because before going into an exam, you need a bit of confidence also, right?
True.
So if you have that, even then also your mindset is a bit better, I feel.
Okay.
Mm. Mm.
Doctor, now anybody who's new, very new into this journey, so what would you tell them? Like four important things that absolutely you have to do that and you can't crack the exam without it.
For the okay, for the exam,
Yeah.
uh, I think the handbook is on top
Okay.
for me because along with the practice questions, it also gives you a perspective into the
Yes.
examiner's mind, like what kind of questions. If of course it's outdated, but still it's very helpful.
Mhm.
And secondly, I would say time management is very important when you're going into this exam because I also had like 5 minutes left
Okay.
before was completing the exam. And you don't have to rush if you keep practicing MCUs. Like if you take a course from academically, like you can practice, and there are other Q bags also if someone wants. So you just have to be practicing that way. And third thing, I would say, yeah, recalls are helpful. Like,
Okay.
yeah, like you guys also provide it, and you can find it also on Telegram groups, and like you have to struggle to find these things. They are not very easy, but they can be found.
Mhm.
And fourth thing, I would say, just like take that leap of faith. Don't think about it too much. Just do it.
True.
Yeah, because people keep thinking, thinking, thinking. Yeah,
Yeah,
I
I
feel
think
that.
too much
Yeah,
overthinking actually kinds of confuse you. So I would say
yeah.
just
Uh,
give in your hard work, give in your best shot, and then just
mm, just go
wait
for
for
it.
the
Yeah.
results to come out.
Mm,
Okay.
mm.
And tell us like what are your plans ahead now? Are you going to go for AMC 2, or are you like still not decided about it and you want to like take some
Ma'am,
time
actually,
to
my internship finishes on 15th May.
okay.
So after that, I will like I have to give IELTS also first. So I'll probably give IELTS. In
Mm-hmm.
the meantime, only I'll give IELTS, and then I'll try to find a job I know it is difficult, and if that doesn't work out, then I will go for clinical only directly. Otherwise, first I will try to find a job, and meanwhile I'll try to find a job here also.
Okay.
I think,
So,
yeah.
since you mentioned that you are doing your internship, so you have already given
Mm.
your FMG exam. So,
Yeah.
like
Mm.
a lot of students who are doing their MBBS, from outside
Mm.
India, what would you advise them that should they, when they complete their course, should they like
Mm.
opt for
Mm.
AMC one straight away if they're planning to go to Australia, or should they, take some time or
Mm.
start their internship before?
Like, of course, it depends on person to person, but if you ask me, like my personal opinion, it
Yeah.
would be to do internship here because at least you
Okay.
will have a registration of your home country.
Okay.
Like you have something to fall back on, at least. And
Okay.
also, you do get experience when you work here, right? And
Yeah, that is true.
I personally wanted to have that experience also before choosing something else.
Okay.
So that is my opinion. Of course, everyone will have their.
Yeah. True. So thank you very much, Dr. Satvik, for sharing your insight, and we wish you all the
Thank you,
very
ma'am.
best.
Mm.
And I think we at Academically are very proud of you. And thank you for giving us this opportunity to be able to be a part of your journey. Thank you so
No,
much.
no. Thank you, ma'am. Thank you to
Thank you.
Academically also.